I'm Jon Caldara, president of the Independence Institute and your devil's advocate. Well, this time around, Obamacare closer and closer to reality in a state near you. To talk about it from the Independence Institute, our expert on healthcare, Linda Gorman. Thanks for being here.
Thank you.
And from the Galen Institute, a good friend of mine, Grace Marie Turner. Thank you for being here.
Nice to be with you, John. Thank you.
What exactly is the Galen Institute?
We're a think tank like the Independence Institute, but we focus just on health policy and particularly free market ideas based in Alexandria, Virginia, right across the river from Washington, D.C.
And just so people know where you stand, I wonder how that is, why Obamacare is wrong for America.
In case there's any equivocation.
In case you were wondering.
Right.
All right, I tell you what, let's start off. Where exactly are we in the process? I know we've got lots of different lawsuits coming, but that's not stopping the administration and a lot of states from going ahead and implementing. Where are we?
This 2,801-page law is on a fast track to implementation. New rules and regulations are being written in Washington every single day. And it's really operating on a number of fronts. You've got the judicial, you've got the legal challenges, you've got Congress trying to delay, dismantle, disrupt any way they can the implementation. But the administration is full bore, moving ahead to put this law into place.
What does that mean? I mean, a lot of us didn't even know what's in that law, and I think a lot of people who voted for it didn't know, because a lot of it is happening by regulation. So in other words, it created more committees and regulatory agencies. They're going to make the rules by which we live, so we really don't even know what it looks like. Am I on target?
You are, because even though it's 2,800 pages of legislation, there are at least 2,000 references to the Secretary the Secretary of Health and Human Services has enormous power over this 1/6 of our economy, a $2.5 trillion economy, to really try to run it from Washington. So you're right, they're writing all these rules and regulations to explain this is what Congress really meant when they said that the states have to set up exchanges, for example. Or the Secretary is going to tell us this is what needs to be in the benefits package that Congress is going to require you to have under penalty of federal law, or you will be fined. To this, you've got to spend your private money to purchase a product that Secretary Sebelius will define. There's nothing like that in our history, but that's the kind of power that she's going to have with this law.
And the states now are also fighting with this. They're the ones who have to put up the exchanges. They have to. What do states have to do now, and where are we?
Well, what people don't usually understand is that there's a tremendous amount of money in the bill to bribe various entities that would normally be against it. So states get a tremendous amount of money to set up state exchanges, and states get a lot of money to set up new ways to share your medical records with everybody but your doctor. And the other thing that's going on is hospitals are getting a tremendous amount of money from this. So in addition to...
When you say that they're getting a lot of money, I mean, how are they getting money?
There are grants in the bill. They're called planning grants or whatever. You get so many $1 million if you do this. You get so many $1 million if you do that. So if your state puts together a healthcare exchange, we're going to give you X amount of money. If you put together some sort of system for all the medical records to be centralized in a database, we'll give you some more money. In fact, is it New Mexico that's leading the charge in grabbing all the money? Oh, no, it's allocated across the states. Colorado's already done database work. We have an all-payer database here that's been authorized, and you won't be able to stay out of it. Your doctor will be fined if he doesn't send all of your medical records to it, and it's going to be shared with some regional organization that doesn't have to follow HIPAA privacy requirements.
So in other words, my private records with my doctor, talking about every little rash I've ever had, is now going to be centralized.
No, it's every little psychiatric visit you've ever had.
Oh, lovely. And let me tell you, there's a number of them. So, so that now becomes centralized, and the government has a role. How much of this is corporate welfare? I'm thinking about the stimulus packages. Every company seems to get something, and is this just a way to pay off every interest to make sure they're on board, because it seems like the insurance companies sure love it because you're forcing people to buy your product, you're turning them into a utility. Pharmaceuticals seem to be surprisingly happy with it, and then you've got all these database companies and hospitals and the rest. Is that part of a plan?
They all believe that this huge expansion, the law is supposed to increase the number of people with health insurance coverage by 32 million. Still leaves 23 million uninsured, but 32 million people get coverage. And there is a huge funnel of subsidies that are going to be created. The exchanges are going to be delivering subsidies for people who get coverage through so-called private insurance, but we can talk about whether or not that's really the case. And then the states are going to be administering a huge expansion of Medicaid. So 25 million more people are going to be on Medicaid. So it's really looking at this huge funnel of money that's going to be following these people every single month, every single year, every single decade, and everybody wants a piece of that pie. But there are, needless to say, I mean, it's the way this works is $500 billion in cuts from Medicare, $500 billion in new taxes to pay for this massive expansion of coverage, 32 million more people, without doing anything to reform the programs, to reform the infrastructure that has caused prices to be so high, unrealistically high in the health sector.
Let's see if I can put it in terms that even I can understand. So in other words, everyone is now required to buy a product.
Will be in 2014.
We don't know what that specification will be.
Secretary will tell us.
For those of us who are fans of high deductible policies, which allow us to save money and be more involved with our health care decisions, those likely will go away.
My policy will be illegal.
Really? What kind of policy do you have?
I have a policy with a large deductible, and it's too big for Obamacare. It says in the law that I think it limits them to $2,000 and $4,000 or a percentage of your income. So in either case, my policy wouldn't qualify.
And the idea of that is, below that deductible, you're out shopping around to see where I'm going to go for my checkup and get the best price and the best quality. But you have enough insurance that if something really goes wrong, you're covered.
Yes. And in fact, the kind of policy I have has shown that people do consume less health care and premiums go down for that. But that's the one, consumer-directed health care is the one reform that Obamacare does not include.
Now, here in Colorado, we have insurance that's mandated for drivers, that you have to buy car insurance. By the way, it's not if you breathe, or it's only if you own a car. So those people who don't own cars don't have to do it. But still, something like 18% don't buy insurance. I still have a rider on my policy because I know there's a good 1 in 5 chance if I'm in an accident, it's with somebody who doesn't have insurance. If I understand this, it's like this health care policy we'll be able to buy after we have the car accident. In other words, if I find that I'm sick, I can go out and I'm guaranteed to get what incentive do I have if I'm not on insurance to buy it?
And you know, that's already what's happening in Massachusetts. Massachusetts is a test case for what Obamacare is going to look like. They've got a mandate that everybody has to purchase health insurance. It's actually a stricter, a bigger fine than Obamacare, $695 eventually in Obamacare if you don't purchase health insurance. It's much higher in Massachusetts. And already people are saying, why should I buy a $5,000, $10,000, $15,000 family policy when I know that the insurance companies are required to sell me a policy, even if I wait until I'm sick to purchase it, and I'll just pay the fine. And it's going to be worse with the federal law because the fines are lower. McKinsey & Company assumes that 30 to 40 million people are going to just say, I'm taking my chances. I'm not buying insurance, which means that the insurance pools will be filled with many more sick people, and you're going to wind up with adverse selection, a death spiral. And many people believe that the appearance that people are going to be purchasing private insurance is really a very temporary phenomenon, that ultimately we are going to default into the government having to run the whole thing because there's no way the private insurance model is going to be able to work under those kinds of circumstances.
What about the quality of care? I mean, this is the part I worry about. We keep hearing that people are going to emergency rooms now. That if once we have this, they won't clog up the emergency rooms. They're going to go see their doctor, and therefore we're going to save a lot of money.
Right. And the biggest users of emergency rooms are people on Medicare and Medicaid, because You don't pay if you go to the emergency room. Uninsured people use emergency rooms at the same rate that insured people do because they pay for most of their own health care. So what you're doing by putting everybody into government plans, like 28 more million people on Medicaid, is clogging the emergency rooms. And in fact, that's what's happened in Massachusetts. There are much longer waits now in the ERs.
How can that be?
That can be when you have
because Massachusetts did what Obamacare does, so we've got a test case. We can see exactly what happened. So costs go down, coverage goes up, and treatment is better because people are getting serviced when they're sick, not when they're terribly ill and have to be rushed to the emergency room.
But in Massachusetts, costs have gone up. Waiting lines
care has gotten worse, and lines have gotten longer.
They're about 100-day wait for a primary care physician appointment because they did nothing to increase the number of doctors. They increased the demand without increasing the potential for supply.
See, Grace Marie is so kind. I think it's because they totally misanalyzed the problem. And the problem is not that people don't get enough care or that people don't have access to care. The problem is that we have third-party payers and that too many people are spending other people's money on health care. And what Obamacare does is everybody's spending other people's money on health care.
Everybody's insulated.
It gets easy. Talk to me a little bit about how this affects seniors, because this is what you do to scare people. And the AARP supported Obamacare, even though I don't understand this, so help me. Even though Medicare is supposed to be cut by $500 million, $500 billion. Oh, sorry, $500 billion to pay for Obamacare, but yet the AARP supported this. What am I missing?
Washington politics is a strange phenomenon. Even though I've been there for many decades, it's who's at the table. AARP stands to gain a huge amount from the Medigap policies that they sell. And if everybody is in Medicare, traditional Medicare, which is a 1965 design insurance policy, then they get more money from these supplementary policies. So they're in line to say, how can we help you plan that?
So in other words, they're an insurance provider, just like the other providers who are
absolutely
making money off this.
Well, they're a different provider, though, because most of the private providers are Medicare Advantage, and Obamacare wants to do away with Medicare Advantage.
As does the AARP.
And because then all you have left are these Medicare supplemental policies. And what most people don't understand is that there is no cap on the amount that you can lose under Medicare. There's nothing like after $8,000 the company pays everything. Medicare basically has unlimited liability because the benefits stop at 360 days in the hospital and certain other things. So there are people every year who owe the government $45,000, $50,000 because their Medicare benefits have stopped. And that's why you need these supplemental policies. It is an insurance policy that only a government could love. Yeah.
But you're right. I mean, AARP sold seniors down the river. They basically said, fine, take the $500 billion out of Medicare to fund 2 massive new entitlement programs, not only the subsidies that will be delivered through the exchanges for health insurance, but also a massive new long-term care insurance program that the Democratic chairman of the Senate Budget Committee called a Ponzi scheme of the first order that Bernie Madoff would have been proud of. So they create 2 new huge entitlement programs, taking money out of Medicare and creating this rationing board of 15 people who are going to be making decisions about how Medicare money is spent with no judicial oversight, no administrative oversight, and really technically no congressional oversight. So you have 15 appointees, technocrats, who are going to be able to basically have the authority to direct hundreds of billions of dollars in Medicare savings, with seniors having basically no recourse over this. And that's why they're outraged.
When I look at this, that we have the same amount of doctors, we have the same amount of hospitals, we have the same amount of nurses, and all of a sudden we're going to be offering new coverage to a whole big group of people, and we're expanding the benefits for almost everybody else who has insurance because new things will be required to be covered. Now,
it's easy.
Now let's see if I get this. So the demand has to go skyrocketing up.
Right.
So how do we decide who gets the treatment and who doesn't get the treatment.
You've heard of barefoot doctors?
No.
Mao showed us the way. The Cuban system is great, says Michael Moore. Basically, you're going to have less qualified people treating you.
So in other words, we're going to have more and more people. People have to get into healthcare.
No, you'll be going to see a nurse practitioner or a nurse. In England, for example, you can be delivering a baby at a hospital where there's no obstetrician present.
So it's basically like having a midwife.
Yes, and if you get into trouble,
you've come a long way, baby.
There's a reason why their maternal mortality rates are rising.
Is Obamacare more popular now than when it was passed? If I recall, when it passed, public opinion was sizably against it.
Congress was getting 100,000 calls an hour before they took this vote. The great majority of them saying, please don't pass this. They were marching on the Capitol, doing everything they could, passed on a completely partisan vote. And it is no more popular today than it was the day it was passed. And every day, every week, we see new evidence of the impact this law is going to have on our economy. Just recently, we're looking at employers are going to drop coverage. So it's going to be even worse.
Give me an example of that. I mean, is this...
McKinsey & Company did a survey of, I don't know, 1,500 employers, detailed, in-depth survey. What are you going to do when this law goes into effect? The employers, from small, medium, large employers, the people who knew the most about the law were the most likely to say, I'm out of here and I'm sending my employees to the exchange. 50%.
Because incentives matter. If I'm an employer and I see that my insurance rates are going up and up and up and up, which apparently they have to.
And they will even more under this law.
They have to.
Yes.
At some point I can just go, I'm sorry guys, it's no longer an employee benefit. I'll give you all a little raise. And then you go out and go to the exchanges. You cannot be turned down. So, and I get to go on. Another reason why I think, did a lot of businesses like this because they knew that they could cut off their employees?
I think businesses are really frightened. I actually think that this law and the risks that it poses is a huge reason that employment is flat. They are scared to death to add new employees. A piece in the Wall Street Journal just yesterday about anybody who's adding employees or adding temps because they don't want to hire them, because they don't want to be at risk. McDonald's putting in automatic ordering kiosks. CVS is putting in automatic checkout. They're trying to eliminate jobs everywhere they can because they're afraid of this law. And it's not only jobs, but the taxpayers are going to be on the hook. Right now, we have about 168 million people who have coverage through the workplace, families, dependents of workers and workers. If this law goes into effect, according to McKinsey's and Company's study, that could mean that 78 million people are going to wind up having to change their coverage categories. Many of them are going to be in the exchange. The former director of the Congressional Budget Office, Doug Holtz-Aiken, has said that he believes that as many as 35 million more people are going to go into taxpayer-subsidized coverage, leaving their employer coverage. So it's going to be on our nickel. And when you look at what's happening in Washington, with the budget fights and the debt ceiling fight, where is the money going to come from? And so you're going to collapse the employer-based system, give people only the option of these new exchanges. You're going to dump all these additional people into Medicaid. The states are fighting it, battling it in the courts, saying we can't afford it. And you're going to wind up, I think, back to your earlier question about quality, you're going to significantly erode the quality of the infrastructure of medical care in this country.
When I'm trying to understand all of this, and it gets really confusing really fast, it's not done yet. There are possibilities this might not happen.
This is in law. It is absolutely going to happen.
It is absolutely going to happen.
This is the law of the land. The administration wants us to just sit back and pretend everything's going to be fine. This is law, and that nothing else needs to happen.
It's a good way to look at this that they are forming now a healthcare utility operation. Now, we have utilities. We have phone companies and electric companies and water companies, and they're allowed to be profitable. They go to some PUC, Public Utilities Commission. They say, can I raise our rates? And they go, sure you can, and you just pass it along. And so those companies are guaranteed their 5%. 5% profit. Is that what we're doing with insurance companies?
Well, sort of, and it's also, The problem is, though, that then you can use these companies for whatever political end you wish, like Xcel Energy here in Colorado is charging very high rates, keeps going up, because the state thinks they should do more green energy, so ratepayers have to pay for windmills that don't work and whatever. Denver Water gets to raise rates because it didn't put enough money away to repair its pipes and people conserved too much water, so it raised its rates. This is what public utilities do. If you start thinking about the fraction of your budget that health care is, this is a very dangerous position to be in, because basically it lets the government say, hand over whatever I tell you to hand over, or you don't get health care. Somebody dies.
So the first time in American history, government puts a gun to your head and says, you will buy a private product to our specifications. We will tell you what you have to buy, and if you don't buy it, we will punish you.
Yes.
Nice stuff.
One of the judges who's ruled on some of the early court challenges to this, 26 states joined Florida in a challenge to this, to the law, and he basically said, if the government can do this, it really turns us into a police state. If this is declared constitutional, what's to keep the government from saying, you know, we now own a big chunk of General Motors. We think that in April, everybody ought to buy, every third person should buy a General Motors automobile. If the federal government can tell us that we have to use our own private money to purchase a product that may very well likely be the first or second most expensive product in a person's budget. By the time this is fully in effect, health insurance is going to cost $20,000 a year for a family, required by the government to pay it.
And health insurance, this isn't about buying health care. This is about buying it in a particular way. I could go out and pay cash for my kids' eyeglasses, but under Obamacare, I have to pay the insurance company to go out and buy my kids' eyeglasses because children's vision stuff has to be covered. This is the most expensive possible way to buy your kids' glasses, and the government shouldn't be forcing us to buy something in a very expensive way.
You have a chapter in your book, Why Obamacare is Wrong for America, which of course everybody is going to buy right now, and liberals can burn it. Well, but that would be carbon. Anyway, what do you suggest for people who are still fighting this? There are people who say, wait, I want to do something about this. Do we fight it? Do we delay it? Do we put it in court challenges? What do people do? I mean, because the frustration is as high now, I believe, as the day it was passed.
I think that's right. And it's going to get worse as people start to see the impact. As seniors start to find it more and more difficult to find a physician to see them. As the Medicaid program starts to implode, the chief of the Johns Hopkins Medicine has basically said, we can't handle this many more Medicaid patients. If employers drop coverage, all sorts of promises are broken. The president has said that every family is going to save $2,500 a year if my plan, on health insurance, if my plan goes into effect. Well, we just learned from the GAO today that health care costs are at least going to stay as high as they are. Some families are going to pay $2,100 a month more. So what can people do? Ohio just collected some number of hundreds of thousands of signatures so that they can get a measure on the ballot this fall to basically challenge Obamacare and say, we want it to stop at our borders. I know you've all fought a heroic fight, and for a lot of technical reasons, I think you lost that. But having some ways for the state to say, we don't want this. There are laws that are...
And here in Colorado, John Suthers, who is our Attorney General, is taking on that battle, I think doing a very good job. So how many, there's 27 states.
There are 26 states associated with the Florida suit. Oklahoma and Virginia are suing on their own, but there are several dozen lawsuits against this law. So following that, people mostly need to be informed. They need to understand how this is going to affect them. Seniors need to understand that you cannot take $500 billion out of this program and tell people that Medicare is going to be a healthier program as a result of it.
Let's go in the opposite direction. We've got to admit that there are people who are hurting. There are people who want to get coverage who can't get the coverage they need. That there are people out there who are in between jobs, and with unemployment being so high, they can't get what they need, and it is expensive. So it's very easy for us to rip on a plan that is ridiculous, and it will collapse under its own weight. There's no question about it. But what is it that we're supposed to be doing? I don't think our team has done a very good job of outlining, here's what we think would be better, and we're going to work towards this. I thought we had some good ideas when it came to HSAs, and I believe they work, but they never seem to get the steam, politically speaking.
Well, there's the political battle is different than what we should ultimately want. I mean, I think the vision of a system that would work is we need to think about how much less expensive health care would be if it was like groceries. It wasn't regulated. It didn't have third-party payers. You didn't have the government telling what doctors what they should do. I mean, some estimates are that excess regulation is 15 to 20% of U.S. healthcare spending. And you can see how much less expensive it is if you go to one of the Minute clinics, where for $50 they can diagnose you and treat you for a lot of common issues. Whereas if you go to a private physician or to a clinic or something, it might be $200. So we really need to think about first of all, reducing the price, which means reducing regulation so that people can afford care, and they don't need hugely expensive insurance to be able to afford care. And that means,
in other words, cash works.
Cash works.
If Americans do anything,
cash works.
We shop around.
We shop really well.
We know how to compare.
Yes.
What should we do? We've only got about a minute left. So you've done a great job ripping it apart. Now build something up. People are hurting. What do you want?
Every state is different. States need to look at what have they done to make health insurance more expensive in their markets. Undo some of those regulations. Help people to be able to purchase more affordable policies.
Less mandates.
Fewer mandates, fewer regulations like guaranteed issue community rating. The federal government needs to rationalize the way that it subsidizes health insurance, both for the huge tax break for employment-based health insurance and the huge waste in public programs like Medicare and Medicaid. There's enough money in the system to provide health insurance for those 50 million people. We need to target the problem. We need to help people who don't have coverage. We need to help people that are in programs that are not serving them. Focus our energies there, focus our resources on something we can do, not try to re-engineer.
This fight isn't over.
No.
Because anyone armed with a pocket calculator knows it can't work. It's not going to work. It cannot work.
Cannot work.
Linda, thank you. Grace Marie, thank you.
Jon.
Pick up the book at Amazon.com. Listen for me late nights on 850 KOA. Check out the Independence Institute at independenceinstitute.org. We'll see you next week.